Hello, students. This time we will be talking about communicable diseases, but we will focus on diseases that you get from contact with soil. Okay, so let's get started. For diseases from soil contact, we have 5. So there are many, of course, diseases that you can get from soil contact, but these 5 are the ones that are commonly asked in the board exam. First, you have your whipworm or Trichuris. We also have your hookworm. We have your Ascaris, also known as your giant roundworm. And we have your Strongyloides. And last but not the least, you have your Tetanus. Okay? So they have a very peculiar shape. So 4 of these are, as you can see, helminths. And 1 is a bacillus. Okay, so let's talk about them one by one. Let's begin with your whipworm, also known as your Trichuris. So this is also known as trichuriasis, and the organism that causes this is your Trichuris trichuria. Now, it has a very characteristic egg. So under the microscope, it looks something like this. The egg is elongated, and as you can see, there are 2 knobs at each end of the egg. So that is your whipworm. When it becomes an adult, so this is what it looks like. As you can see, so the worm has a thick end and a thin end. So most people will assume that the head of the worm is on the thicker side, but they are wrong because that portion, the thin side, is where the head is located. It is also the reason why they are able to really dig into the gut, into your intestine, and burrow their heads in there. Most of the time it is asymptomatic, so you already contracted the parasite and yet there are no symptoms unless it reaches about more than 16,000 eggs. So that's a lot. Then it will become bloody diarrhea, or they call this parasitic dysentery. You have your anemia because, as you know, the worms will eat most of your nutrients, your protein, and because of that, it can lead to your anemia. Then you have your appendicitis. Now, the reason for the appendicitis is because of the worms. So they block the your appendix, and that causes its inflammation. As for its transmission, Trichuris is transmitted, as we've said, from soil contact. How? So it is actually from swallowing of these eggs from the soil. So let's say, for example, the child is playing outside with some toys, for example, and then without washing their hands properly, and the soil is infested with your Trichuris eggs, then you will be able to swallow that when, for example, the child will eat without washing their hands. So that is how the infection happens, or the infestation happens. So the incubation period is about 2 to 3 months for Trichuris. And the treatment of choice is your albendazole, mebendazole. So these are your drug of choice for parasitic infections. Next is what about your nursing responsibility? So simply put, if we're talking about worm, it has something to do with sanitation, and because the board exam might ask you about soil contact, so defecation, sanitary defecation practices should be instituted because this is contracted from the soil. And another is proper food handling. So why did we place that there? Because sometimes when you go, let's say, for example, to the farms, let's say strawberry farms in Baguio City, see this strawberry that that is just waiting to be plucked and tasted. So please stop yourself from giving it a bite, because without properly washing it first, because as you know, you might be eating some nematodes with it. The next one is your Ascaris, also known as your giant roundworm. Now, Ascaris, your causative agent here, or your organism, is your Ascaris lumbricoides. Okay. Now, For its feature, so as we've said, this is known as your giant roundworm. Now, the thing about Ascaris lumbricoides is that it has a propensity to have some form of lung migration. So the signs and symptoms will include pneumonitis, wherein, as you can see here in this picture, there in this X-ray, there are worms in the lungs because for the life cycle of Ascaris, so once you have ingested you have swallowed the eggs of Ascaris, and then it goes to your gut. Now inside the gut, it will now burrow into your intestine, so it will now go to your lungs. Okay, so once it goes to your lungs, it will penetrate your alveoli, your bronchi, and you have that there. So that is your Ascaris lumbricoides. Now, it can lead to the coughing of worms. So if you have an infestation for years and there are a lot of worms already, so it is possible that, let's say, for example, the child will cough out, and then you will see, let's say, a worm in the sputum. Yes, so that can be your Ascaris lumbricoides. I hope you're not eating during this time that you're watching this lecture. For this male and female Ascaris, they want high oxygen content, so they would migrate to the lungs. Now, if prolonged infestation happens, it can lead to your intestinal obstruction. If you watch some of the videos on the internet and you see that they're operating on a person with infestation of Ascaris, you will see that in a kidney basin they would have this bowl of moving as spaghetti like Ascaris lumbricoides. So that can lead to your intestinal obstruction, so they have to operate on that. So you have your vitamin deficiency for especially for children, as you know, the worms are able to deplete you of the vitamins that you would need. Usually you will see zinc deficiency, vitamin C, vitamin D deficiency in these children. So the transmission is the same for whipworm and giant roundworm. So the swallowing of eggs from soil. And then you have your incubation period that lasts about 10 to 20 days. So it means that from the time that you have swallowed the eggs from the soil, it takes about 20 days for it to become infective. Okay, so, or for it to show some of your signs and symptoms. But it can take months to years of infestation before somebody has a coughing of worms. The treatment is your pyrantel pamoate and your albendazole as well. So as for your nursing responsibility, it's the same. So you have hand washing, sanitary defecation practices, and proper food handling. Now let me give you a hint about these three worms: Trichuris, Ascaris, and the next one, which is your hookworms. So they are mostly seen in developing countries like the Philippines. And you have these three. So once you have or you're diagnosed with one, it is not uncommon for you to be found to have the other two as well. Okay, so because they are usually, as we've said, seen in communities where the defecation, they have problems with latrine use or very unsanitary in terms of defecation. One of the medical missions that I've been to, I've come across some of the practices of other communities, other villages. So some of them will just dig very shallow pits. Now let's talk about hookworms. Okay. For hookworms, there are two major parasites of hookworms. First, you have your Ancylostoma duodenale and Nicator americanus. Now, there is also a type of hookworm which infests dogs. This is a zoonotic parasite, so the dog hookworm can actually penetrate the skin of a human. Let's look at the hookworm. Why are they called hookworms? So as you can see, they have this fang-like teeth. Okay, so you see that the end. So this teeth is this is what they use to just grab on to your intestines and not be swept off during the defecation process. So they just, have their hooks on you and they take your blood. Yeah. Here, this picture denotes or signifies what we call as your cutaneous larva migrans. So there you go. So this cutaneous larva migrans, it's because of its transmission. The transmission of hookworm is fecal, soil, skin. So it's not fecal, soil, oral. Instead, it is fecal, soil, skin. So what it does is that's why you have your characteristic sign of ground itch. If you let's say, for example, you walk barefoot on the grass or on the soil, so the hookworm will enter the skin, of your foot, and there you go. So you will see the underneath your skin, the worm will go to your gut. Okay, so it's serpiginous, meaning it creeps along for days. Okay, so it's days to weeks actually. So it creeps along slowly. So this is actually not the worm itself, but the larva. So it's the larva that migrates through your or underneath your skin, and it's very, very itchy. It's pruritic. So if you scratch this out, so you will see, so it's because of your eosinophils, so it will react. Okay, so the hookworm can cause anemia, known as your hookworm anemia, and because of the fact that it sucks about 0.2 ml of your blood per day. And that's considering that's one worm. So if you have a lot of worms on you, so you get, you are donating blood to them. Then you have your transmission. As we've said, it's fecal, soil, skin. It's not fecal, soil, oral, unlike the other two, which is fecal, soil, oral. So the incubation period is about 8 to 10 weeks. Now, for hookworms, the treatment will be the same as your Trichuris. It will be mebendazole and albendazole. And your nursing responsibility will be to educate your patient not to walk barefoot and to handle dog poop with care. Now, another thing that you can tell your patients is that they should not, for people who are like sunbathing, so especially tourists. So some tourists will come here and do sunbathing, and they once they go home, they will see that on their skin. So if you do sunbathing, make sure that you have like proper protection, because like a mat or something, because if you just lay down on the sand or on the soil and there are hookworms there, so they will just penetrate your skin, and then you will see on your torso, or your trunk, or anterior abdominal wall, this cutaneous larva migrans. Okay, so that is the third. So you have your hookworms. Now the fourth disease, communicable disease that you can get from soil contact is known as your Strongy roundworm or Strongyloides. So it's also known as strongyloidiasis. Okay, so the organism is known as your Strongyloides stercoralis. Now you will see this very peculiar rash, and this is known as your larva currens. Now, the pathognomonic sign for strongyloides or strongy will be its autoinfection. So it's not necessary for them to mature in the soil, which means that you can have autoinfection. What do I mean by that? Let's say, for example, you are infected by your strongy, okay? So it can lead, so it also has lung migration, just like your Ascaris. As we've said, it's fecal soil skin, just like your hookworms. Now, for patients with Strongyloides infection, you don't it doesn't need to go to the soil to become infective again. Usually in the life cycle of other worms, they have to be passed out, and then they have to stay on the soil for a couple of days or weeks for it to mature and then infect other people. But for Strongyloides, it is not necessary, which means that once the eggs are, let's say, well, once the eggs are produced in your gut, so it will now move out into your rectum, and you will defecate. But that the strongyloides in the rectum can now again penetrate your rectum through the skin, through your perianal skin, and then it will now go back to your gut. Do you understand me? So it's like an auto-infection. So you defecate them, but they come back because it penetrates the skin. Now, as we've said, the lung migration happens, and the parasites found in your lungs, this is known as the Loeffler's syndrome. And it's very characteristic of Strongy and Ascaris. So you will see hemoptysis, you will see pneumonitis in your patient. But the problem with strongyloides is that, as we've said, because of the autoinfection, it can lead to what we call as your hyperinfection. The treatment for this is ivermectin and albendazole. So as you can see, albendazole, mebendazole, they are the most common for parasites, treatment for parasites. Now, for your nursing responsibilities, tell your patient not to walk barefoot because, again, this is fecal soil skin transmission, not fecal soil oral. And then you have to tell your patient to watch out for any diseases or any circumstance that will lead to low or a compromised immune system. Because if the patient will have a compromised immune system, the number of worms, or the worm burden, as we call it, will increase. And when that happens, the worms can migrate to other ectopic areas aside from the lungs. So it means that it can go to your peritoneum, it can go to your brain, it can go to your blood, it can go to your CNS. So what is the problem with that? Remember that it is normally inside your intestine, and which means that the worm, the strongy, has on its body fecal matter. Now, if it migrates to your brain, to your peritoneum, with the fecal matter on it, it can lead to septicemia, to sepsis. So that is the problem with strongyloides, and that is why it can lead to what we call as your hyperinfection. Okay, so those are the 4 worms that can be transmitted through soil contact. Now, as for the last one, this is not a worm. This is a bacillus, and we are familiar with this. This is your tetanus. Now, tetanus is caused by your Clostridium tetani. Okay. There you go. So the problem with the Clostridium tetani is that the bacillus itself is not as resistant as compared to the spores. The spores are your problem. They are so resistant that they have the only way for the Clostridium tetani spores to die is through superheat, which is through autoclaving. So if you, let's say, for example, if you just heat the instruments, like boil them or like put alcohol on them, the Clostridium tetani bacillus will die, but the spores will remain. And the problem with the spores is that they release toxins, and those toxins have this propensity to go to your brain. So what does your Clostridium tetani look like? Look at this. There you go. So it's very characteristic in shape, in that it seems like it has a head and a tail, right? Or it looks like mini drumsticks, so if you love fried chicken, the small ones like right there, those are your Clostridium tetani, and it is found in the soil. Now, there are misconceptions that it is found in rusty nails, but that is a misconception. It's found in the soil. So the break in the skin, that is now their entry point. That's very characteristic of the signs and symptoms of your Clostridium tetani, which is muscle spasm that leads to your rigidity. And this one is your opistotonous posture. So you see, because of the muscle spasm and the rigidity, the back, this is a spasm, the back of the infected person hyperextends, as you can see there. And that is very characteristic. This is because of the muscle spasms, no, and that leads to the rigidity. Now, this is another classical sign. This one, the half green, half smile, half snarl, or snarling smile, known as your rhesus sardonicus. It's also very characteristic of your tetanus. And of course, you have your trismus, which is your lockjaw. So these are all characteristic of your tetanus. The reason behind it, as we've said, is because these toxins that are released from the spores of this Clostridium tetani they love the nerve tissues. They will adhere to your nerve cells, and they will cause this reactions. Now, the contact with spores and abraded skin is your mode of transmission. And the spores, as we've said, is mostly found in the soil. And of course, another way to transmit this is through the unsterile cutting of the umbilical cord. As we've said, only autoclaving can kill the spores. There's so many neonatal mortality that is attributed to tetanus, especially for those who do not deliver in hospitals with sterile equipment. Okay, so that is your tetanus. So the incubation period is about 14 days. There is a range. For some books, they say like 4 to 21 days, but 14 days is the agreed upon average. Then you have your treatment for this. I know you've heard of the preventive measure. It's vaccine. The responsibility is actually vaccination. You have to teach your patient vaccination. There are 5 doses of tetanus toxoid that is given to pregnant women. I will discuss to you in detail on the next slide when it will be given and what immunity it confers, because these are being asked in the board exam. Okay, let's talk about your tetanus toxoid, or your TT. So you have 5 tetanus toxoid shots for pregnant women. So the first one, you give it as soon as you know that the patient is pregnant. So as soon as pregnant, first TT1. But it does not confer any immunity, no protection. For the next one, TT2 is given 4 weeks after TT1. And as you can see here, it gives about 3 years of protection. TT3 is given 6 months after TT2. And it confers about 5 years of protection. The next one is TT4, given a year after TT3. And it gives 10 years of protection. Then your TT5 is given 1 year after TT4, and it will protect the woman during the childbearing age. Okay, so this is a little bit tricky, but you have to memorize this so that you will not get it wrong when this is asked of you on the board exam. Okay, so let's review that again. So you have your TT1, given as soon as you know the woman is pregnant. It does not confer any immunity. TT2, given 4 weeks after TT1, gives 3 years immunity. TT3, given 6 months after TT2, it confers about 5 years immunity. TT4, given a year after TT3, it gives about 10 years of immunity or protection. Then you have TT5, given after a year of TT4, and it gives you protection throughout your childbearing age. Now, that is your tetanus toxoid vaccination. Okay. Now, let's have some tests. Okay. So, you can test yourself with this. So, what are the causative agents? So, these are some diseases and what are the causative agent of these diseases. Okay, now let's see your answers for giant roundworm. Okay, remember giant roundworm, you can see them when they're taken out. It causes intestinal obstruction. Ascaris lumbricoides. Next, whipworm. The first one we talk about, it's your Trichuris, Trichura, F. Tetanus, it's your Clostridium tetani. If you got that wrong, you have a problem, okay? So there's a clue with the name. Hookworm, so there are like two types of this. The other type is not here, Nicator. So you have Ancylostoma duodenale here. Then you have roundworm. Of course, it is your Strongy, Strongyloides turcaralis. Now, if you're asking why did we not discuss letter E? Letter E is Enterobium vermicularis. It is actually your pinworm, also known as your threadworm. Now, this is not a disease that you get through soil contact. It's actually fecal oral route. So that's the reason why it's not included in this discussion. But this is also a nematode. Next test. So test yourself. Disease, match the disease with its pathognomonic sign. Time is up. Let's answer this. So for giant roundworm, this is your Ascaris lumbricoides. So your classical sign here is that it has lung migration. And because of that lung migration, once the child coughs up, the sputum has worm. So letter E is your answer. Whipworm, normally asymptomatic, unless of course it takes about years. Then you'll form some anemia. Tetanus, you have your classical green, half snarl, Rhesus sardonicus. Then you have your hookworm. So you can see them creeping under your skin, larva migrans, serpiginous, which is it creeps along for days. With the other one, Strongy, hours. Yeah, couple of hours, then it's gone. Then you have your roundworm, Strongyloides, which causes hyperinfection. Okay, that's the end of our discussion for communicable diseases that you get from soil contact. So I hope that you learned something from this lecture, and I hope this helps you in your study. That's all. Thank you.